are decreasing across parts of the country, but one small rural area, one part of Georgia, now leading the nation in the most new COVID deaths over the last couple of weeks. The New York Times listing Milledgeville metropolitan area as one of the hardest hit areas in the country. Hancock and Baldwin counties make up this area, which is about an hour west of Augusta. The I-Team's Liz Owens reports on this growing outbreak.
Not only does Hancock and Baldwin counties now lead the nation with the highest number of new COVID deaths, but they also have the least amount of available ICU beds in the entire state of Georgia. Even the national news can't ignore the stunning numbers coming out of Hancock and Baldwin counties. The area only represents 0.5% of Georgia's total population, but the I-Team found it is currently leading the entire country in new COVID deaths over the last 2 weeks. The two counties make up the Milledgeville metropolitan area, according to the U.S. Census. Data from the New York Times shows the death rate is doubling here every 8 days, and it's not slowing down. It shows the deaths are still growing. That's significant because only 2 other areas in the United States are listed as still growing. Everywhere else shows deaths are flat or decreasing. The I-Team first told you about the outbreak in Hancock County a few weeks ago. Data from the Georgia Department of Community Health shows as of Tuesday night, 18 patients have died at Sparta Health and Rehabilitation Center, and 4 others have died at Providence Healthcare of Sparta. A total of 124 patients and workers are positive for the virus, and a county made up of only 8,400 people. A county that is rural with a high African American population and high poverty rate, all factors that have proven to be high risk factors for the coronavirus. At 4 nursing homes in the neighboring county of Baldwin, nearly 20 have died and 150 patients and workers are positive. The health department remains concerned about those workers spreading the virus outside of nursing homes and into the community. Georgia College and State University is also located in Baldwin County, and with more than 7,000 students expected to return to class in a matter of months. Resources are tight here too. The hospital closed in Hancock County years ago. The nearest one is about half an hour away. The I-Team found 77% of the ICU beds in this region are already full. That's more than double the percentage statewide. As of today, only 9 critical care beds are available. 85 nursing home workers in Baldwin and Hancock County are positive for the virus, and the health district is very worried about them spreading the virus through a community. Once again, a community that is in a college town. And right now, the more than 7,000 students are learning online, but they could be going back to class in just a matter of months. Liz Owens, on your side.
All right, thank you, Liz. Now back to Doctors Hospital, where 9 staff members there have tested positive for coronavirus, and they all work on the same floor, on the 3rd floor of Doctors.
But they're not the only local medical workers to test positive. Cindy Heiberger is looking at how prepared hospitals are for outbreaks among employees.
You've heard it time and time again. It only takes one asymptomatic person to spread the virus to any amount of people, but things can get a little tricky when those people are the ones in charge of caring for us.
That was exactly the case at Doctors Hospital when 9 employees recently tested positive after coming in contact with an ER patient who didn't know they had the virus. In a statement, Doctors Hospital says out of an abundance of caution, they even temporarily paused admissions to one area of the hospital. But Doctors isn't the only one. University also had an outbreak in their Kentwood Extended Care Facility last month, where 9 staff members got sick. And as of May 22nd, Edgefield County Healthcare says 5 employees there tested positive. Dr. Pasha Schaefer is the Chief Quality Officer at AU Health. She says when staff get sick, things can get tricky.
There were a couple areas that got pretty slim.
We asked all our major hospitals how they're keeping healthcare workers safe so they can keep us safe. The responses were similar across the board. Temperatures taken before every shift, everyone screened before entering the hospital, treating COVID patients in a separate area, and of course, extra cleaning.
On our 5 West, which is our inpatient COVID unit, they play a song every 2 hours and wipe everything down when they're all singing along.
Safety measures in place and all.
I have been so proud.
Being on the front lines is risky business.
Doctors Hospital tells us all 9 of the employees who tested positive are doing well and are quarantining at home. Reporting in Augusta, Sydney Heiberger on your side.
Glad to hear those employees are doing okay, Sydney. Thank you. At Augusta University, one group of healthcare workers is as close to the front lines as you can be with those COVID-19 patients. Respiratory therapists at Augusta University are in charge of monitoring your airways, which, as we all know, that's what the virus affects. They are protected by special PPE that takes 15 to 20 minutes to take on and off. AU had to rent ventilators and buy more equipment so they didn't run out, but AU says the work these therapists are doing is saving lives.
Swollen, it tends to be difficult to move air in and out, and they simply would not be able to breathe if we weren't able to use a ventilator. The respiratory therapists were nervous. They didn't know what to expect.
AU is also using plasma and experimental drugs to treat COVID patients. We're going to show you inside the COVID unit tonight at 11.
Also this evening, Tropical Storm Bertha.
And they simply would not be able to breathe if we weren't able to use a ventilator. The respiratory therapists were nervous. They didn't know what to expect.
AU is also using plasma and experimental drugs to treat COVID patients. We're going to show you inside the COVID unit tonight at 11.
Also this evening, Tropical Storm Bertha made landfall on the South Carolina coast this morning. Wind speeds right around 50 miles an hour, sending rain up into parts of our area earlier. And this comes even days before the official start of hurricane season. Sierra Cummings spoke with local emergency planners, getting ready, who also have coronavirus to worry about this season.
This school, Westside High, doubles as a shelter during hurricane season. But this time around, shelters in Augusta will have new challenges. So much so, officials are looking to hotels and churches.
It really is looking at it as a disaster on top of a disaster.
If natural disasters brought in a storm of chaos before, the pandemic brings a hurricane of complications now.
By the nature of what it is, it's not going to go according to plan.
But planning is the greatest resource Augusta officials hold to manage this year's evacuee sheltering.
We will be using PPE for everyone. There will be also temperature screenings when everyone comes in.
In previous years, the city has opened up to 16 shelters, many of which were schools, to house those from the Savannah Coast and local neighbors who lived in mobile homes. But considering now all evacuees would need to be 6 feet apart, the current shelters may not be enough.
Hotel rooms or dorms or churches, other partners in the community where we can do smaller groups of people at greater distances together. We have people that have already got some new arrangements. We're working with other colleges to get new arrangements.
Red Cross, along with Augusta EMA, are still finalizing plans, but they know this year relying on the local health system will be more critical, including looking for quarantine-type evacuation sites for those who may be medically compromised. With hurricane season beginning in a few days, officials are on a time crunch to have things set in place. Realistically, Everett notes it may not be until after the first storm they know how to respond to the gusts of COVID issues likely to arise.
It's certainly going to be a challenge for all of us because it is most important that we keep everybody safe and healthy.
In Augusta, Sierra Cummings on your side.
And remember, because Augusta helps Savannah during storms, EMA is working with Savannah officials on transportation and new shelters. Meanwhile, the state is urging you to get hazard insurance this year. We posted resources for how to do that on our website.
An update now to an I-Team story about these
Breaking storms, EMA is working with Savannah officials on transportation and new shelters. Meanwhile, the state is urging you to get hazard insurance this year. We posted resources for how to do that on our website.
An update now to an I-Team story about these break-ins at a local school. We're learning today 5 teenagers have been arrested in connection to these break-ins now. You can see windows busted, computers destroyed, junk everywhere, even technology, including iPads, were stolen. This is at McBean Elementary in Hepzibah, which was broken into 3 nights in a row. We were not told if any stolen items were recovered, but the 5 suspects include 4 17-year-olds and 1 15-year-old.
The Shepherd Community Blood Center still